Think about the way you eat, breathe, and speak. It's not something many people truly think about, but for many, they do all of this with the help of a voice prosthesis. Your larynx is where your vocal cords are, so when someone has a total laryngectomy, meaning their larynx is removed, they can no longer speak. The air that comes from their lungs no longer comes out through their mouth, it comes out through a hole in their throat called a stoma. So, when patients get fitted with a prosthesis, it involves the small device being put in the trachea. This diverts air from the lungs through a valve and into the esophagus, otherwise known as your food pipe. It then puts the air back into your mouth. Through vibrations created and training with a speech and language therapist, patients can learn to speak again. But of course you have to eat, and with that comes bacteria and microorganisms. The bacteria in your mouth can stick to something called biofilm at the top of the device, and this build-up can stop it from working. There are serious potential consequences if this voice prosthesis becomes infected, so preventing this biofilm from forming was the key to helping patients. Almost a decade ago here at the University of Kent, Dr. Campbell Gourlay helped to develop a way to keep the valve clean. Alongside Kent Cancer Trust, the biosciences team joined forces with other scientists and clinicians, and they found that the voice prosthesis would frequently fail because of a yeast called Candida albicans. So they developed something called an antifungal treatment strategy to try and extend the life of the voice prosthesis. This would mean that patients would get their valve changed less, but also hospital visits would be dramatically reduced. So to go into a little bit more detail is Dr. Campbell Gourlay. I went to visit him at his lab at the University of Kent to see what the voice prosthesis looks like, but also see how something so simple can drastically help the lives of hospital staff and patients.
So I'm a cell biologist and a microbiologist, which means that I'm interested in the study of microorganisms. We were contacted by the local hospital trust, by the speech and language therapist there, who was interested in trying to improve the quality of life of her patients who were fitted with one of these devices. This little thing here, which is called a voice prosthesis or speaking valve, it's applied to patients when they have had their larynx removed, and this is typically patients who've had advanced laryngeal cancer.
So alongside the antifungal gel is almost like a toothbrush that you would use for your teeth. Explain a little bit more about how patients would use that.
Yeah, of course, you're quite right. It is exactly like brushing your teeth. And they simply brush their prosthetic twice a day by inserting the brush that's provided by the manufacturer, and it quite nicely fits in and cleans the valve. So the application of the antifungal will help to prevent the biofilm from forming on the prosthetic, and just as cleaning your teeth would stop plaque build up, which is a biofilm, you stop the biofilm from building up on the prosthetic for much longer. Just to give you an idea of the time scale, patients would sometimes have to come in every 2 weeks to have their valve changed. And so our patients that are on our pathway would typically be anywhere between 6 months to 2 years before they would need a replacement instead of 2 weeks.
Okay, so the numbers are impressive, but what about the everyday reality of a patient who's going through the treatment pathway? I went to Kent and Canterbury Hospital to meet Rich, who was diagnosed with cancer in 2008. He had to have his larynx removed along with radiotherapy as part of his treatment, and then, years later, became a part of the research. He met me with his wife Jenny to chat about what the prosthesis is really like day to day and how their lives have changed. Getting that news must have been, well, terrifying, I guess.
Yeah.
Can't deny that.
No. He was losing his voice for quite a while. Couldn't hear him, he was a whisper. He decided to go to the doctors, and then everybody was very quick to put cancer pathways into operation to find out what was going on. And he had a total laryngectomy with reconstructive surgery of his throat. So he doesn't breathe at all through his nose, it's all through that valve in his throat. Later on they put the speech valve in, And then obviously from there he learnt how to talk with a valve and how to cough properly by taking in some breaths or something, wasn't it?
So tell me a little bit about your journey from then to now.
The valve that goes in my throat. Had to have that changed quite often originally.
When he started, it was at the maximum 3 months he would go. But generally it was around 6 weeks and him changing that valve, and that trauma as well, keep changing that valve in his throat.
Around 6 years ago, I went on a course of studying, and that seems to have worked wonders. I had to have the valve changed about a whole 4 years.
Has it, helped and changed life a little bit, and knowing that you don't have to worry as frequently?
Absolutely. The worry was gone. At the moment, anyway, let's touch it wood.
Was it strange to kind of learn how to talk again, in a way?
Yes, quite difficult to start with. I managed. So, yeah, very important. But I've got a voice.
Absolutely. You wouldn't be able to speak to people properly, would you? You wouldn't be able to use your phone. Yeah, you'd just be joining in, but not really there.
Layla Williams is a speech and language therapist. She works with many patients who have had the device fitted and can be with them on their journey for decades, helping them to speak in a new way and adapt to this monumental change in their lives. She is one of the few who knows the impact that having a voice prosthesis fitted can have on patients and hospitals. This device, this treatment helps people to speak and eat and breathe. So how impactful is it and how important is it? Because, people lose their voice in a way and they have to then relearn how to speak.
Absolutely. So immediately after surgery, patients don't have a voice at all. And until a voice prosthesis or a speaking valve is fitted, they may need to use alternative means of communication. So that could be mouthing, writing things down. And then once they are given the opportunity to have a voice again, it can actually be quite emotional. And we find sometimes that patients are quite tearful and they can tell their loved ones things for the first time they haven't been able to say for a number of weeks sometimes.
What kind of specific things do you do with these patients to help them recover and move on with their lives?
So getting the technique right for producing voice is really important. To be able to divert the air that's coming normally in and out of the stoma when a patient is breathing, we need to teach them how to divert that air through the speaking valve. So that means covering over the stoma, the breathing hole in the front of the neck. So you need to get a really good seal to make sure that there's no air escaping and then everything is channeled through the speaking valve, because that's what gives the best quality voice.
And in terms of the pandemic as well, this dramatically reduces hospital visits, right? So how impactful has it been during the pandemic for these vulnerable people?
Absolutely. We were obviously at the height of the pandemic wanting to prevent people from coming into hospital sites as much as possible. So the fact that we've got a successful treatment pathway that allows patients to have a longer time between hospital visits is much better in terms of reducing their risk of infection and protecting patients and staff.
In males across the UK, head and neck cancer is the 4th most common. And most head and neck cancers actually occur in the larynx. Kent Cancer Trust funds projects that seek to improve the treatment of cancer patients in Kent, and they helped to put the team of experts together for this project.
Clearly, I hadn't appreciated that there was a real problem with patients who'd had their larynx removed. What we were asking them to do was to find out what caused the problem, how that problem could be fixed. We've supported a whole range of cancer-related projects where we've undoubtedly increased people's knowledge, but we haven't actually come up with something which is actually tangible and which makes a difference to people. To find that we've actually achieved that, I think is really tremendous. What we've achieved, we've made a difference.
Laryngectomy procedures extend beyond just Kent, of course, and the project has helped patients across the UK and the world.
We have distributed the guidelines for the treatment of the valves quite widely over the UK to different trusts, but also worldwide. So we have sent the guidelines to Australia and the US. There are currently around 60,000 laryngectomies that have one of these devices fitted. It's the gold standard for speech restoration.
A day is a long time for patients and hospital staff. Have you looked into the costs for the NHS, for example?
Well, there are a few things to consider when you're calculating the costs. Of course, there is the ongoing treatment, the replacement of the valves, the clinician's time. It certainly saves many millions to the NHS.
As a result of this team's success, they can apply a similar strategy to patients who have had a tracheostomy. This is done when people have trouble breathing, like you see in hospital programmes. They're also helping those who use a feeding tube to pass nutrients into their stomach, which can make you really vulnerable to infection. They're also working on something pretty high-tech too.
This involves collaborating with engineers and polymer scientists to build electronic devices that can be embedded within prosthetics and can detect the microorganisms attaching and growing on their surface. So a patient who had one of these fitted with one of our detection chips would be able to, using a handheld device, monitor whether their device is becoming infected or not from outside the body.
The future is exciting, but right now, a lot of people are safer and will have found their voice again.